Essentially, we see a fair number of children every year who are referred for assessments for autism. And at the moment, there isn't a medical test that we can perform that will indicate to us whether or not, definitively, whether or not a child has an autism spectrum disorder. Now, the Autism Diagnostic Observation Schedule, or ADOS for short, is a semi-structured interview and play-based assessment that we use with very young children right up until and also with our teenage children as well. And it enables us to look at things like a child's communication, how well they interact with us, whether they have any play and creative ideas, and also whether they're presenting with any restricted and repetitive patterns of behaviour. The ADOS was originally developed by using some of the activities and the materials on typically developing children, and that enables those that are using it to compare the profile of the children that we see with how typically developing children of that age and that language developed would normally present. Clinicians using the ADOS must be trained and experienced in working with children with autism, and they require formal training in the ADOS before they can actually use it. It's really important to say that the ADOS should never be used in isolation from other sources of information. If your child comes for an assessment, we will sometimes use the ADOS, but we will always meet with parents to find out about their early developmental history and to find out what their current concerns are about their child. So the ADOS is one piece in an assessment jigsaw. The ADOS usually takes around 45 minutes to an hour, depending on the child. When a child comes for an ADOS assessment, there are usually two clinicians in the room. One clinician will try and engage the child and will try out all the activities with the child, while the other person in the room is involved in observing and taking notes. For children under 5, parents would always be in the room with the child, but over that age, it's usually preferable for a child to be seen without their parents. And that's because some children and young people will always rely on their parents to help them with the answers and may not then interact with the person who's actually carrying out the assessment. However, having said all of that, we can be flexible, and we would always try to think about an individual's situation and needs on the day. So we always try to make the experience of coming to see us an interesting and enjoyable one, and we certainly wouldn't want any of the children and young people that come to see us to think that this is a test and it's something that they've got to pass, because it isn't like that. The ADOS includes lots of interesting activities, looking at a book, with the younger children playing with some toys, and with our verbally fluent children we would also be asking them questions about different aspects of their life. If a child is able to understand, or a young person is able to understand why they are coming for assessment, or the fact that they're coming to a new place to meet with us, we understand that can be very stressful sometimes. So we're very happy for you to talk to your child about why they might be coming or what to expect when they do come. But apart from that, there isn't really anything else that you can do to prepare your child for the assessment when it takes place. Some parents are worried about whether or not we'll be able to capture everything that we need to know about their child on the day. It's important not to worry about that, because the ADOS allows us to look at some very subtle things and subtle features that might not be obvious to another adult who isn't experienced in using the ADOS.